Are you moving? Well, then you definitely want to avoid this major Medicare moving mistake. Hi there. As always, if you have any questions whatsoever about your Medicare coverage or health insurance in general, you can reach us in the comments below or at the number on the screen. We're licensed nationwide and there is absolutely no charge for our services. But before we dive into today's video, a friendly reminder, please go ahead and make sure to subscribe to stay up to date. And of course, click that like button so that we can get this information out there to those with Medicare who may be moving or not. When you're eligible for Medicare, there are so many options to choose from. You can of course choose to go with original Medicare alone, or you can choose to enhance it with a Part D plan, which will cover your prescription drug needs, or a Medicare supplement plan to cover those copays, deductibles, coinsurance, and possibly impose an out-of-pocket maximum. Or of course, you could forego original Medicare entirely and replace it with a Medicare Advantage plan. These plans are also known as Part C plans, and basically they have to offer you at least the same benefits as original Medicare, but many offer additional benefits like dental, vision, hearing, and prescription drugs. They can also offer lower copays, deductibles, coinsurance, and impose an out-of-pocket maximum. But they certainly come at a cost. Medicare Advantage plans will have networks, sometimes very restrictive networks, and you'll also have to deal with referrals and pre-authorization. So please proceed with caution. Now, dependent upon the type of Medicare option that you choose, some plans may be available nationwide, some plans may be determined by your geographical location, some are just offered by the federal government if you're just going with original Medicare, and some are offered by private carriers. So, if you are moving, the course of action to take is determined by, of course, the type of plan that you have. But it all boils down to the same possible mistake, which is not utilizing the special enrollment period that you may have available to you if you move. So when you move, you may be eligible for a special enrollment period for a Medicare Advantage plan or even a Part D plan. If you move outside your network's area of coverage, then you will want to look into other plans available. And this is really a great time to reassess your current plan as well as your copays, your premiums, and compare them to the new plans that are available to see what plan is going to best suit your needs. Things can be a little bit trickier with Medicare Advantage because Medicare Advantage does have those networks. So it's pretty likely that if you move, you will no longer be in the coverage area and you won't be able to find a doctor or a hospital who accepts your plan. So you would enter into a special enrollment period. This is sort of like that bonus time to reassess. So definitely do your research into providers and hospitals in your area that you may want to utilize to determine what plans and carriers they work with. Then you can use that short list to determine which plan is best suited to your needs. As always, make sure to evaluate your most important and basic benefits first, and then compare those fringe benefits that may be offered by a Medicare Advantage plan, because many Medicare Advantage plans do offer additional benefits to entice beneficiaries. And of course, make sure to compare all the financial costs as well, your premiums, copays and coinsurance, out-of-pocket maximums, etc. Now, should you find that this plan isn't exactly working for you, of course you can always rectify any mistakes made during the AEP, but dependent upon what time of year you move, that may be pretty far away. But an even bigger mistake you may be making is not taking this opportunity to switch to a Medigap plan. Now, original Medicare can be very confusing. Medicare in general can be very confusing. And when you first turn 65, you will likely be inundated with mailers, flyers, emails, phone calls, and it can be easy to become overwhelmed with all this information. As a result, people often sign up for a Medicare Advantage plan without really fully realizing what it is that they are giving up. Now, there is a reason that Medicare supplement plans are just far more popular across the country than Medicare Advantage plans. However, as someone new to the world of Medicare, it is quite easy to be lured in by the shiny promises that Medicare Advantage makes. For example, many plans claim that they are free. Are they free? Absolutely not. At the very least, you still need to continue to pay for your Part B premium. As I said earlier, Medicare Advantage plans will often boast about the additional benefits that they offered, which are not offered by original Medicare, like dental, vision, hearing, and prescription drug. And these can be benefits that are very, very important to you. They may also offer additional benefits like transportation or gym membership or free perks at certain grocery stores or pharmacies. And with the addition of lower copays, lower deductibles, lower coinsurance, it can certainly seem very, very appealing. And please note, for some people, they are. Dependent upon your needs and the area of the country in which you live, Medicare Advantage plans can be great. But there are major pitfalls, and these come in the form of those restrictive networks, pre-authorization, and referrals. And I cannot stress enough how big of a deal these are, especially when you compare them with the flexibility that Medicare supplement plans offer. Very often, the younger beneficiaries to Medicare, people that are 65 when they're signing up, don't have significant health needs. So when they look to compare a Medicare Advantage plan, which is offering all of these additional benefits at a lower cost, versus a Medicare supplement plan, it's very easy to see why someone would choose the Medicare Advantage route. However, as we age and we tend to have more extensive health needs, many people report that their Medicare Advantage plan just no longer serves their health needs when they need their plan the most. And unfortunately, very often at that point, this person finds themselves unable to switch to a Medicare supplement plan, which would provide that more comprehensive health coverage. And yes, Medicare supplement plans, especially plans F, G, and even N, really are sort of the Cadillac of the Medicare world. They will help to cover or possibly entirely cover your additional copays, coinsurance, and deductibles. So really you can think of it as the all-inclusive approach to healthcare. You pay a larger monthly premium up front, an additional monthly premium to keep your Medicare supplement plan active, but it's going to take care of almost all of your out-of-pocket bills. Additionally, with a Medicare supplement plan, there are no networks. Almost all doctors and hospitals accept Original Medicare, and if they accept Original Medicare, they will accept your supplement plan regardless of who the carrier is. So if you have a major medical need and there is one hospital or specialist that is an expert in that field, as long as they accept Medicare, and as I said, most do, you can go see that doctor or utilize that hospital, and you don't need referrals or pre-authorization. So it's really going to cut out the middleman and all of that waiting. So that's why Medicare supplement plans are so much more appealing to those who have more extensive health needs. However, very often people wait until they are experiencing those more extensive health needs to switch to a Medicare supplement plan. And at that point, you could be denied or charged more. Because really you're only guaranteed access to any of the plans when you first become eligible. So you first become eligible for a Medicare supplement plan in the 6-month window after you turn 65 and enroll in Medicare Part B. During this time, you will not be subject to medical underwriting, so you cannot be charged more or denied. Should you choose to enroll outside of this window, then you may be subject to medical underwriting, which means you could be charged more or denied outright, unless you have a Medicare Advantage plan and you are going to lose coverage when you move to a new location. So yes, at this point you can certainly enroll in a different Medicare Advantage plan if that's suited to your needs, but you can also use this time to enroll in a Medicare supplement plan. And this is again our #1 recommendation, and definitely something we feel would be a mistake if you have the opportunity to enroll in a Medicare supplement plan and you don't do so. Now, it may take a little bit of paperwork, but a qualified broker should be able to assist you with the transition to make sure things go smoothly. Another mistake would be to not reassess your Medicare supplement plan when you move. Now, Medicare supplement plans are portable. If your doctor accepts Original Medicare, they accept your supplement plan. So if you were in Georgia and you had a Medicare supplement plan with Humana and you moved to California, it doesn't matter if your doctor doesn't traditionally accept Humana. If they accept Original Medicare, they're going to accept your plan. So yes, you can take your plan with you basically wherever you go. However, the price of your plan, your monthly premium, is determined by a series of factors: your gender, your age, and your location. So you may find that when you move to a new area that the plans available are all of a sudden less expensive. So you definitely want to stay on top of the plans available and always reassess to make sure that you are getting the best bang for your buck. As always, if you have questions about your Medicare, you can reach us in the number on the screen or in the comments below. We are licensed nationwide, so we work nationwide, just like your Medicare supplement plan. There's no charge for our services, and we are more than happy to help answer any and all of your Medicare or health insurance related questions. But before you go, please make sure to subscribe to stay up to date, and of course, click that like button to help us get this information out there. As always, thank you so much for watching and have a wonderful day. Bye-bye.